We will talk about multivitamins, if they are really effective. Around 30% of Americans regularly intake multivitamins, so they are so popular. And let's discuss what are their true indications when they are required for our body. First is nutritional deficiency. If person has confirmed nutritional deficiency of any vitamin, for example vitamin B or vitamin C or folate or other vitamins, multivitamins can be prescribed. So first indication is nutritional deficiency, which is confirmed by blood tests. That's first. Second is pregnancy. During pregnancy, there's frequently folate deficiency, because folate is required to prevent normal neural development of kid, to prevent birth defects. That's why folate is very important. And iron is also important, because iron deficiency anemia is very common among pregnant. That's why most recommendations are towards folate and iron intake, or many cases prenatal multivitamins. So first is nutritional deficiency, second is pregnancy. Third indication is dietary limits. What means dietary limits? For example, if person is vegan or person has food allergy, at this case there is dietary deficiency of certain vitamins, for example B12 in case of vegans. So at this case also it's possible that multivitamins effective and multivitamins requirement is clear here also. Fourth most common cause and most common indication is old age. When we age, our absorption of nutrients is decreased. That's why multivitamins can help. And bariatric surgery also important indication. During bariatric surgery also person has less absorption of vitamins and minerals. That's why intake multivitamins are important. Now let's say truth about vitamins and cancer. There is some urban legends that vitamins increase risk of cancer. Some of them say that vitamins decrease risk of cancer. What is true? According to latest and largest meta-analysis, vitamins almost no effect on cancer. They slightly decrease risk of cancer, especially lung cancer, if the multivitamins are intaken regularly. There is slightly decreased risk of cancer, but it almost same as general population. So no significant effect on cancer. Another important thing and question is if multivitamins affect our lifespan or mortality rate. And truth is that according to latest meta-analysis, vitamins does not increase lifespan. It means it does not decrease mortality. It has no effect on mortality. So person will live as much as he or she should live without vitamins, also without intaking multivitamins. So vitamins has no important effect on mortality rate also and on lifespan. Now about risks. What are the risks related with multivitamins? Usually no important risks also. Their intake does not cause any serious risk factor for health, but there is some studies according to them intaking a high amount of vitamin E and vitamin A increase risk of lung cancer slightly and in older ages, and in high amounts. High levels of vitamin E and vitamin A can slightly increase risk of cancer, but this increase is not very prominent and very important. So multivitamins usually has no important effect on our general health, on our there is no important health risks. Also, it's already good because lots of people in taking vitamins as a supplement. Now about weight loss. In case of weight loss, also there is no significant difference between people who intaking multivitamins and not intaking. But there is studies about vitamin D, and vitamin D can slightly help for weight loss. Vitamin D and calcium intake can affect person's appetite, can affect mood, and can affect total calorie intake indirectly, of course. That's why they can help. But this difference was not also very prominent. So in case of weight loss, multivitamins is not very effective also. Now, for what is effective multivitamins? It's effective if it contains vitamin C and zinc, because it stimulates immune system, and it improves our immune function against common cold and flu and such respiratory infections. So it can be beneficial against common cold prevention and easy symptoms of common cold and respiratory infections. Also, vitamin D improves muscle strength and bone structure. That's why vitamin D composition is important, especially in older ages when there is decreased absorption of calcium, and most older adults have some degree of osteoporosis and lack of calcium also. And vitamin B has positive effect on cognitive function, on cognition. It's important also. So there is important benefits from vitamin C, from zinc, from vitamin D, from vitamin B. Of course, there is small other benefits also, but most prominent from multivitamin is these benefits. Now let's say about safety and duration of intake. Several months of intake of vitamins is considered safe. And if that question also, if I should intake with food or without food. With food is better to avoid stomach upset, and also to improve vitamins absorption, especially vitamins which are fat soluble. Fat soluble vitamins better to intake with food for better absorption. And in case of water soluble vitamins such as C and B, for example, it does not matter if you intake them with water or without water. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.